I want to, again, I'm Andy Weber with the National Business Coalition on Health. So delighted you're here. Welcome to the second day of our National Health and Productivity Forum. We have another exciting program agenda for you today with great speakers. But before we get started, just a few words. Want to encourage you, most of all, to fill out your evaluation forms. We really listen to the comments and feedback that you give us every year, and it does influence our program planning. So in the back registration area, you will find evaluation forms. There's also on the app, if you want to give us some feedback, there's a mechanism to, in real time, give us some feedback on the sessions. But again, we value your input, so please fill those out. We've had a tradition at the Health and Productivity Forum. Tom and I always have the great pleasure to introduce our board chairs. And I get that honor today. Barbara Wallace is the board chair of the National Business Coalition on Health. So she is a leader within the NBCH member coalition community, having been elected to the board and then elected as board chair. Barb Wallace is also the president and CEO of the Virginia Business Coalition on Health and has been in that position for quite a few years, 17 years. Yes, applause for that. Applause for that. Coalitions have been on the landscape for over a couple of decades. In fact, we have coalitions that have been around since the late 1970s, 1980s. And it's, again, a wonderful opportunity for me and our staff to interact with our coalition leaders around the country. So with no further ado, I just wanted Barb to say hello and welcome and say a few words before we get to our first general session. Barb?
Thanks, Andy. Good morning. It gives me great pleasure to welcome my coalition colleagues and their employer members and the members of IBI to Dallas for our 5th joint meeting. I've attended 4 of the 5 meetings and always take away a lot of good information and data. Yesterday we heard from some excellent speakers, excellent examples from jumbo employers like Capital One, Kraft, Safeway, King County. This theme of meeting and bringing health and productivity together is one that impacts large employers, but also mid-size and small employers. Job growth cannot be isolated to just large employers. There are many startups and entrepreneurs interested in wellness, health, and productivity. For a year now, the Virginia Business Coalition on Health has been working to develop the Virginia Center for Healthy Small Business, which is basically a virtual website with health and wellness resources to assist small businesses, preferably no cost or low cost. Our focus group of small business owners have realized the impact of health and wellness when we ask them, but they really don't know what to do about it. They feel the impact of employer absence and illness and lack of productivity, just like the large employers or corporations. But they always are saying that the large corporations have more resources to absorb the impact or the loss. So similarly, they have fewer resources. They have employer money, time to devote to health and wellness. So they need our help. It's been a challenge for the coalition to think differently about how to offer resources to this sector of the population of the workforce, because we have primarily large self-insured employers. We do have some mid-sized and smaller employers, and we're beginning to see more interest in that segment of the employer population. So I want to challenge IBI as well as NBCH to sponsor more programs and research on this group of employers. They're really interested in the impact on health, on wellness, from physical, organizational, and business terms. I thought about this a lot, and I thought perhaps we can take the resources developed by IBI and NBCH and apply them to this sector of the workforce, which is growing. Maybe we could develop a mentoring process whereby large employers would adopt smaller employers in their community to nurture who may be one of their suppliers or their vendors. So this is something that we are thinking about, and something that you might also. I just wanted to mention that because it has been a challenge and an opportunity that we've been working on in Virginia for a year with some support from the Virginia Department of Health. And we want to continue this and we want to sustain it. But, you know, there are challenges there like there are in any new programs and et cetera. So again, thanks to the Planning Committee for this conference. Thanks to Andy Weber and Tom Perry, the leadership of these two organizations. Thank you to the conference participants for taking time away from work to attend this 2.5-day session. And also a great deal of thanks to our sponsors who have helped supported us to make it possible. Thank you and enjoy the rest of the conference.
Thank you, Barbara. Some really good ideas. As the first panel comes up, you know, the issue of integration, which this panel will address, is one where you got to get a whole lot of people working together. And 3 years ago, we had a panel of employers and their supplier partners talking about the reality of integrating their programs because you can't do it alone. So we thought it'd be a great idea to bring that panel back and talk about what's new in this issue of working together through integrated programs. So I'd like to introduce Dan Lyons of Liberty Mutual, one of my old friends in the industry and been a board member of IBI for years and a former chair of IBI. So Dan, thank you.
Old friend. God, getting old. Good morning, everybody. My name is Dan Lyons, and I'm responsible for the national account operations at Liberty Mutual. I'm joined this morning by what I think is an outstanding panel of industry professionals, and as Tom indicated, you know, what we want to do is talk about how employers and their vendor partners can work together in a better way to deliver a better experience for employees, better outcomes, better administration, and better management of benefit programs. We'll talk a little bit about the way the world is today, and as Tom mentioned, this is a reprise of a program that we did 3 years ago, so we'll talk about how things have changed since then. And I'll go through and introduce the folks here today. I won't go into a lengthy discussion about their biographies. I can tell you they all went to really good schools, better than the school I went to. They've all been around for a really long time, and as they say in Boston, they're all wicked smart. So starting down at the end here, we'll start with Andy Rosa. Andy's the Senior Director of Health and Welfare Benefits for Comcast. Mr. Rosa's team is responsible for the strategic and operational direction of the healthcare engagement and work-life benefits programs for Comcast and for NBC Universal. Carl Dalal is the Director of U.S. Health and Welfare Benefits for BP Corporation. At BP, he leads a team responsible for all aspects of the design, delivery, and administration of BP's health and welfare benefit programs. Irene Immerman is the Senior Vice President and Employee Benefits Manager for KeyBank. At KeyBank, she is responsible for managing all of their benefit programs, including health, welfare, cash balance, and 401k retirement plans. Mary Tavarosi is the North American practice leader of Towers Watson's absence and disability management practice. Her team works with large employers to develop and implement innovative health, productivity, and absence programs. Dr. Rich Pfeiffer is the National Director for National Accounts at Aetna. Dr. Pfeiffer is a board-certified internist At Aetna, his team develops and implements strategies to help large employers improve the health and productivity of their members. And finally, Dr. Ed Crouch is the Vice President and National Medical Director for Liberty Mutual's Group Benefit Operations. He is also board certified in internal medicine. Dr. Crouch is responsible for the clinical philosophy and day-to-day clinical management of Liberty's disability programs and processes. And just real quick, I'd like to thank, because I don't know if I'll have time to do it at the end, thank the panel for their participation, and in particular, thank Ed for advancing the idea of doing this session again, and for herding this panel over the past couple of months. It's like herding cats, mostly older cats, but it's like herding cats. So with that, I'm going to turn it over to Ed, and we'll get going. Thanks, everybody. I'll come back up to field questions a little bit later.
Thanks, Dan. Good morning, everyone. That went too many. I still vividly remember my first vendor integration or collaboration meeting about 8 years ago. We all got there. We didn't know who else was going to be there. We were herded into a room. Everyone was looking at each other rather suspiciously. And after a short while, though, I realized that I was the only person representing a disability insurer. So I thought, gee, that's pretty cool. They'll all have to work with me at the end of the day. It was really the start of a really fantastic journey. As the years went by, we've seen the silos between vendors come down. We've discovered that we have great colleagues at competitors, and there are great experts at all the other suppliers that we work with and at the customers we support. And so by 2010, we were thinking, gee, there is a lot of potential opportunity for things that if we work together, not only when we were working with a customer, but together beforehand, that we could actually get much better outcomes. So we came and presented to you 3 years ago, and we had a list of things that we thought were really important back in 2010, and those are on the left side of the slide. And as you know, those were much simpler times than today. And since then, a whole lot of things have happened to change where the industry is going, to change our focus. And so here we are in 2013. But I want to go back and just quickly highlight some of the things that we were thinking back then. The colors are really like a project plan, so the green things are the things that I think we have accomplished. So today I think that we all collaborate well with each other. We play in the sandbox well. We send our data off to be integrated. And a lot of communication goes back and forth. People get referred to the right programs so there can be much earlier interventions to improve their outcomes. And then there were things that we thought were very important back then, and I think we've made some progress. People are certainly very aware of the issues, but there's still work to be done, so they're in the yellow color. And you know, first and foremost is employee engagement, and even if you look at some of the most recent studies done by some of the suppliers, the numbers are not terrific. So if you try to recruit a group of people to participate with your program, maybe you get participation at a rate of 20%, or maybe a little bit more. But there's a long way to go. So how could we get more? And we were thinking back then about the ever-increasing health spend and how did we get to Dr. Eddington's zero trend. And a lot of you have implemented lots of great things, but there are still lots of companies that do not have a flat experience with their health spend, so there's work to do. We started to think about incentives, and back then we were thinking about sticks and carrots and broad-based incentives, and today we're kind of now in a realm of thinking about things that are much more specialized. We were thinking about medical homes and how you could actually get people focused on better outcomes. And today we're now thinking about patient-centered medical homes and affordable care organizations in the setting of healthcare reform. And, but none of those things have complete structures or complete expectations, so there's work to do in those. And then disease management, what makes for a great disease management program? I think we get a lot of people referred to them. What is the gold standard, I think, is still elusive. And then those of you that were at the FMLA presentation yesterday, you heard that a lot of times just to get things wired and to get things referred to another vendor, supplier, that you have to go through your own legal staff. And there's, depending upon their appetite for risk, whether they're conservative or a little bit more liberal, it really can hold things up. So back in 2010, we thought it would be great if we could come up with a standard so people understood that you could connect these vendors, these are the type of agreements you need to have in place, so that it was easy, so it was plug and play. But I can tell you that today, we're no better off than we were in 2010. And even though this isn't one of the burning issues today, I really think that there ought to be a call to arms to get people to come up with a standard. So perhaps it would fall on an august group like this, the IBI, NBCH, to start to promulgate something that we could all work with, and so that people would have more ease about what we were doing. And then back then we knew that we needed to put things in data warehouses, and I think we all do that wonderfully, but I think today we're still not sure of how reliable and real-time that data is. And in the ensuing 3 years, I think we've all come to realize that none of us leverage that data. So we do it to some degree, but there's so much that could be learned from everything that's been put in there, and we could start to focus some of our interventions today to improve the outcomes. So as you look through the things that changed from 2010 to 2013, everything now is healthcare reform. I think since then we've come to appreciate that people do improve with wellness initiatives, and that the ROI is significant. And again, we've talked now about targeted incentives and how you get people to actually think about utilizing their data. So as we think about things that are important in 2013, first and foremost, how you integrate all the components of the health plan so that we actually get the better outcomes. What are the right things for wellness, for prevention? How do you engage employees? And so we have some of the best employers here to talk about some of their approaches. One of the approaches is a concierge model. So if you're going to access anything within the health realm, you need care management. You have a single point of entry. Another is health coaching, where you actually get assigned a health assistant, health coach. And in one model, everybody gets one. And so you don't actually need to define different populations based on their risk. You don't need to single someone out because they're a high-risk individual. Everybody gets a coach, and then everybody has a discussion. On-site health centers are becoming more prevalent. They have the potential to hugely improve outcomes. We want to continue to get people into the EAP, but I think we could do it we could leverage it more than we have in the past. We want to leverage that data, and again, we want to make sure that we start holding providers more accountable to the outcomes, and that we provide them with the right incentives. And without any further ado, I'm going to turn it over to Dr. Pfeiffer.
Good morning. Good morning. If there's one message that I think you'll likely take away from this entire panel discussion, it's that integration takes many different forms, and it's been driven through a process of continuous innovation by you, by employers, by health supplier partners, and the like. And yet, that continuous innovation, it hasn't been random, has it? This has come about over time. And so I'll spend just the next few minutes providing a framework that may prove helpful to you, a framework to think about how we've gotten to where we are. And that framework may actually help us figure out what the next versions need to look like. And so if we wind back the clock, what did integration look like 10, 12, 15 years ago? Data exchange, right? It wasn't easy. How many of you were trying to get your health plans and your PBMs and your BH vendors and all the others to pass data to one another 10 years ago? Yeah, it was a challenge. And there were barriers thrown up, and there were concerns and issues, let's just say. We got through that, right? So that was version 1.0. Now it's an expectation. And I would fully anticipate that all of you are having data being passed back and forth. But you know what? Data exchange wasn't enough. It didn't really help us. It didn't help us care for members, employees, patients. We needed to do something with it. And so version 2.0 was true data integration. Put it together. Create insights, learn, figure out what to do at a member level by putting together multiple sources of data. Now, this is 2.0. We got there a number of years ago, but I would suggest that we continue to challenge ourselves with the question, what other data sources need to be pulled together? Sure, pharmacy, medical, BH. Claims data integration was the easy part, but now we're seeing other forms of data integration that are providing additional levels of insight and actionability, self-reported information, biometric information, laboratory results. Version 3.0, where did we go from there? We asked the question, how do we use this data in a meaningful way? And so we started creating processes of warm transfers, letting a nurse and a pharmacist and a behavioral health specialist and others, case managers, warm transfer patients back and forth across the healthcare or the health benefits system that many of you have set up. Very important so that the patient, the member, is not left with 1-800 numbers galore, figuring out who do I call for this. They can call one point of entry, and they should be able to be handheld, if you will, and passed from one place to another as their needs demand. That's very important. We've created those processes. But how many of you are measuring your warm transfer rates to see that they're actually occurring at a level that you anticipate? If you're not, you should start asking, but I would suggest that warm transfers are not the be-all, end-all. We needed to make that work better. We needed to maintain levels of member engagement. And member engagement is a continuous challenge for all of us. And every time you have a warm transfer, you have an opportunity for an engagement decrement, for someone to fall out, if you will. And so that's why many of us started redesigning and rethinking, putting teams together in a co-located manner so that they can be aligned with one another, whether it's across vendors or suppliers, or even within the same healthcare organization, different departments, programs, silos. Putting them together on teams that are accountable for the same population, the same employer plan sponsor. And from there, we ask the question, why do we need teams? Why do we need different professionals? Why do I need one nurse doing disease management, another nurse doing case management, another nurse doing behavioral health? Can't they just take care of the patient? And so we created models that look like single nurse models, and some of you have actually experimented or deployed them, where one nurse is accountable for the case management, or maybe the disease management, or down the road behavioral health needs. And even that presented untapped opportunities because they were still, in some of those cases, functioning in a programmatic manner. I'm doing the disease management program now. I'm doing case management now. Now I'm doing this program or that program. And we got to this point through specialization, decades of specialization in the industry to get really good at those functional programmatic areas. But patients don't know anything about that, nor should they. They just have needs at any point in time, and over time they wax and wane. And so I would suggest that version 6.0, where we are today in 2013, is rethinking all these programs, tearing down program boundaries, and having all the capabilities that you've made available through your benefits program, have them be organized around the patient, the member, not around the program. And that's where we are today as we continue to think, how do we do this well? How do we maintain functional specialization while being member-centric? And so this framework, I hope, will provide guidance for all of us as we think about version 7.0 and 8.0, but I'll turn it over to my colleagues now to talk about examples of all of these. So Mary?
Good morning. Let's think back to that time 3 years ago when, as Dan Lyons points out, we were all much younger and much less gray hair. And we stood up here as a panel and we talked about where integration was then and where we thought it would be going in the future years. And we all had a lot of hopes and we had a lot of crystal ball prognostications about it. And I think we were realistic that we knew change was coming in 2010 to a lot of the elements of the health system, but I don't think any of us at that point realized how much change was coming and how quickly it was coming. So what's changing? Everything, or almost everything. And these changes are really going to affect, and have already started to affect, your health and productivity strategy and your programs. So how do employers further their integration goals when everything and every element around them is changing? And as employers have worked over the past 3 years since our last panel to look at how they can increase program and vendor integration, they've had to contend with all these economic and environmental factors that are changing around them. So they cannot pursue integration in a vacuum, if you will. The game-changing shifts that are happening in the healthcare landscape from healthcare reform are really just part of that equation. So I don't think any of us thought that employers would have to pause a little bit in their integration efforts to ask themselves questions that I don't think we even thought of 3 years ago. So for example, by a show of hands, how many of you employers have had conversations with your vendors or started to prepare for the possible productivity impact when your employees have to go out of work for a medical condition and then may be forced to wait weeks to get a doctor's appointment to be evaluated for disability? How many of you, say one, thank you, RJ, very apparent. But this is the reality we're facing. We may have been talking about doing vendor integration of one point. Now we're pulling the vendors in to have a discussion about how can you all work together to be sure that this isn't going to happen as the landscape changes and the delivery system changes. We don't want those negative impacts to the employee and to the productivity, but they could be coming because of the stressors to the healthcare system. And again, vendors and employers in these integration discussions the last few years, how have they started to look at the new e-media and the impact on the integration efforts for your programs? And most importantly, how are you using these new e-media tools to really reach your employees and engage them? Because employee engagement is another one of the big factors that has shifted considerably in the last 3 years. How are you dealing with the consolidation and changes in the disability vendor landscape? Again, something that we weren't thinking about in terms of vendor integration and program integration 3 years ago, but are very much a reality today. So I would say that these factors are not possibly going to change your integration strategy. They already are impacting your integration strategy. And, you know, as we look at it, though, I think that we can say these factors can lead to some positive change. If you look at the left-hand column, that's what's happening now. So if you look at the continuum of your employees from being healthy and well and focusing on prevention all the way to the employees that are in catastrophic or end-of-life health situations, what we have now is still pretty much a fragmented approach to healthcare and minimal linkages and integration on the productivity side. You know, Rich talked about a few of the warm transfer things that are happening, some of the data integration, some first and second and third generation of case management approaches. But by and large, we still have a system that has a lot of fragmentation, gaps, and minimal integration and linkages. Now, some leading employers have started to move into the next column, the what's next, if you will. And they're building this more patient-centered approach to health and productivity. And they're doing that, and not so much what we anticipated 3 years ago, but the reality is they're doing it through leveraging more of the technology, such as some of these mobile apps that were originally engineered in Generation 1.0 to attack health management issues, but now are being looked at as a possible way to also impact productivity management. Also, being realistic about the new delivery models. So again, something that we didn't focus quite as much on 3 years ago. We thought we'd take the existing healthcare and productivity vendor landscape and we'd integrate those things together. But those delivery systems have changed, such as more emphasis now on on-site health centers, kiosks, telemedicine, and even concierge health models, which are all changing how we approach integration. So really aligning the providers and getting them to focus on both health and productivity while leveraging this new technology and the new delivery models, that's where our opportunity is for integration as we go forward. And we've taken a look at 5 specific initiatives that I think most of you as employers in the room or even vendor providers would say you've been involved in some or all of these initiatives, or you're trying them or you're contemplating them. And what we've done is taking this new reality and the fact that everything's changing, we've looked at these 5 specific initiatives and we've outlined the ways that some leading edge employers have already started to seize this integration opportunity using these initiatives. We're very excited in particular about these 2.0 generation of smartphone app technology and other e-media that's leveraging that first generation of health tools into productivity management. So for example, people being able to report an intermittent absence through their app, report the birth of the baby, work out a return to work plan, chart their progress on the return to work plan, and that type of thing all through this technology. Another exciting development is many employers are now expanding the whole employee incentive discussion from health and wellness into disability benefit design and time off design. So they're putting it together to take a consistent message and integrating their message to employees that you will be incented to do the right things, and this includes in the time off area as well. And they're coupling that with vendor integration help to track and report the outcomes of these integrated incentives. So in spite of very significant changes facing employers, the integration opportunities are still there. We've morphed them a little bit, and we've refocused them based on the realities of the changing economic and environmental factors. But we think that the integration can continue to be successful, and it will be implemented and evolve within this changing landscape. Now we'll hear from some employers on how they're doing it. Irene?
Thank you, Mary. So I wanted to start by just making two brief comments. One is to thank Ed for being our leader extraordinaire, because he has really managed us to tight timetables. And so I likened it to being the Academy Awards here. So I know I need to be done in my 10 minutes, and there's a clock here to tell me that, or the music will start playing and I'll have to leave. So as I've listened so far to the panel, I think what I have noticed has changed is that over the past 3 years, our employees now know that we are focusing on health improvement, and they know it's an initiative that they need to pay attention to. So I'll just tell a little bit of our story. So first of all, KeyBank, who we are, in case you're not familiar with us. We are one of those super regional banks that is in the broad-based retail bank financial services business, and we have retail banks across the northern tier of this country. So not here in Texas, but New York, Maine, Ohio, Indiana, then Colorado, Idaho, Utah, Alaska, Washington, Oregon. So as you can tell, we have a broad population spread over a great geography. We have assets of about $89 billion and about 15,500 employees. And I'm proud to say, what's not on the slide is we, in 2011, have the first female CEO of a top 20 bank. So talk about really good culture. We have a majority female workforce now being led by a very female-oriented leadership team. Just sharing with you a little bit about our employee benefit strategy and priorities. We promote healthy lifestyles and build financial security through our benefit programs is a pillar in our employee promise. So last year, we communicated our employee promise to our employees with our new leadership team, and I was really pleased to see that they gave us some real estate and saw this as a really important value. Looking through what our strategy and our priorities, focused solutions, I think, is a critical part of what we do, because we can do a lot of different things with employees, but employees have a lot of business responsibilities, personal responsibilities, so time is one of the most important precious assets, and we want to make sure that when we take their time, we're doing it in a very focused way. We also connect our strategy to ensuring we have healthy employees to serve our clients. So we're very careful to keep that connection front and center. And then finally, in our benefit priorities, we focus on engaging employees. And I think that's really been, for us, a huge impetus, is focusing on that and measuring that. So given where we've been on our journey, as we looked at what we did in the past, we were focusing a lot on plan design and vendor management over the past decade. We consolidated our health plans. We focused on simple, tried to keep things easy for employees so that they could use the benefits to the best and to their needs. We have integrated our clinical leave teams, so we have an in-house short-term medical leave team of 4 nurses, and we have integrated that team with all aspects of health, whether it be the health plans, the disability plans, we recently workers' compensation, and so we take that focus and look at all that we do throughout our health and welfare benefits. We introduced 2 high deductible plans in 2008, and they were really robust plans with health savings accounts with company contributions, and that's very much aligned with our financial services mission. So we use our health savings account product, and I'm excited to say that we have over 7,000 employees right now who have health savings accounts and over $8 million in assets. So many employees use their accounts, many employees save their accounts. Finally, in 2010, we turned our attention to the health improvement initiatives and a multi-year campaign that we have rolled out. We introduced a wellness premium credit, as many of you may have done, where we asked employees to complete activities in order to earn that wellness premium credit. And our compliance was fantastic. So being a bank, our employees are very compliant. We are heavily regulated, and when we ask them to do something, they do it. So that's really been very helpful. So we see over 90% of our employees do complete these tasks. So I crammed a lot of data on this slide. I'll just share a few of them. We were pleased as we looked at a measurement over a period of years that our average health risks decreased 23% from 2009 to 2011. And we see that throughout our workplace. So we actually see people, and I think we heard this yesterday from other employers, who have lost 100 pounds or more. And I think that's really impactful on their peers. And we've done that in a number of ways. I just showed, though, regarding our employee health status, we've been successful in slightly moving the mark from overweight to normal, but we know that we still need to do better. We've increased physical activity. We used our partners Shape Up, who I believe are here today, and our employees were very excited. We introduced the challenge on a pilot basis in 2010. We had, and then a really positive response. So in 2011, we rolled it out for all employees, whether or not they were in the medical plan. We had over 50% participate, with over a 60% retention rate in the competition. For those of you who don't know, it's a physical activity, internet-based competition. And we extended that over the years to include spouses and partners. And our employees really enjoy that. So as we look toward the future, we have decided to focus on BMI as where we want to improve health. And now that our employees understand that that is part of our culture, that they have responsibility for their health and managing their health, what we're going to do is go to the next step. So up to this point, we have self-reported employee data in our health assessment, except for some random on-site screenings that we've done, but we're moving to verifiable data in 2014, well, actually in 2013 for the 2014 plan. And as we've looked at integrating our vendors, and we work really closely with our vendor partners who are excellent partners, we have actually found, as mental health is such a significant issue, whether it's a comorbid condition for someone who's dealing with other illnesses or a condition in and of itself, that our employee assistance plan is a place that our employees turn. And so as we looked at activities, we started working with our EAP to engage our employees to participate in their webinars on stress management. Banking has been a tough place to be, as a lot of other industries have experienced over the past 5 years. So we know that stress is definitely a problem in our workforce. And we've also worked on vendor referrals from our EAP to our other vendors. So we're looking at that as our employees are turning to them as a place and a vendor that can help us more. We've also found that telephonic coaching and telephonic engagement, which was really the way of the past, is not successful in engaging a big part of our workforce. A lot of people don't use the phone, especially the younger people. They text. They don't really want to be on the phone, can't really talk with retail bank-based employees during the day in any event. And so what we have found is that to improve their health, a lot of employees are seeking internet-based solutions, but they're seeking solutions on their own. And they're looking for the free mobile apps, like the people who have lost hundreds of pounds. As we ask them, how did you do it? They use Lose It. They use MyFitnessPal. And so we know that it's not necessarily just the tools we provide for the employees, it's the tools that they're finding themselves. So where are we headed is continuing to hold the employees accountable. We know the future is going to have a lot of changes, and we're looking toward holding them accountable for outcomes, not just participation. And we're also going to focus on integrating with other employers to leverage community resources, which is really critical as you look at the retail bank and how it's changed. We have banks, as I said, all across the country in very rural communities with just a handful of employees. So we know, first of all, that we churn those employees with like employers in the community. So we all need to keep our employees healthy. And we also know that to find that support group within the community is really important. So just in terms of our path, you can see on the bottom, we introduced the concept of goal setting last year. We are asking employees this year to establish their BMI baseline goals and set targets. We're moved to verifiable results. And interestingly enough, someone mentioned this yesterday, we are starting to see with more and more verifiable results that the numbers are dropping a little. So while I think self-report data is good, it's probably not 100% accurate. So we're not necessarily expecting improvement. And finally, in 2015, we're going to tie the financial incentive to achievement of the target goal. So very, very exciting, and I think that regardless of what happens within the legislative arena and with healthcare reform, we all need to continue to focus on health improvement so that we have productive employees. So now I'll turn this over to Carl from BP to talk more about this.
So there was no music, so that's good, right, Irene? All right, so let me talk a little. My name's Carl DeLaw. I work at BP, and for those of you who have not heard of BP in the last few years, we'll just quickly talk. If your head's been in the sand in the last 3 years, we're what we call a super major energy company. So which basically means we're into all aspects of the energy, everything from the upstream side, which is finding the oil, refining the oil, selling the oil, as well as probably a lot of people don't know, we're very big into the alternative energy also. We're the largest windmill farm in the country. And so the scope and scale of a company like BP and the big oil companies, it's pretty huge. You see some of the data over there in terms of the revenue and employee base. But the interesting dynamic is you see the profile, some key data that we've got over there. We've got 80% plus male population. The average age is almost 50 years old. The employee average person's been there 15 years. So getting the communication to that 50-year-old male who has been entrenched in a certain way of doing things is not the easiest way. And so changing that culture, getting them to move the behaviors is a challenge in itself. So I'm going to talk about 3 things, and so I'm going to talk really fast. Hopefully we get a chance to have some more dialogue either in the breaks or in the Q's and A's. Andy, who's going to follow me, is going to talk a little bit more about how they've done a more robust concierge service to engage employees at a level that they need to. What I'm going to talk about is something that we've partnered with Aetna in being able to implement. I call it a concierge light. And what that is trying to do is we know getting to the employee, engaging them in a way that's relevant and meaningful to them is absolutely a key piece of getting them to be a better healthcare consumer. And the way we've been doing that is, and what we're going to be introducing this April, is this concierge service that gets out of the case of the average employee doesn't know where to call. They more than often call the wrong phone number. They get the runaround. They get frustrated. They get angry at the healthcare system, and it just leaves a bad taste in their mouth in terms of the whole experience. And so the concierge service is really trying to get Aetna to take a more proactive role and work with the employee, listen to them, and get them to warm transfer, be there in the call, help resolve the issues. A lot of the cases we find Aetna is in the center over there, so the medical carrier, the medical insurance company really can help facilitate that, whether it's through the wellness program, resolving their benefit questions, resolving their issues with the doctor, the pharmacy. So that's an interesting model that we're trying to implement to help people be better consumers, engaging them in their health, and meeting the member where they are and whatever issues they've got. So that's a program that we're going to be introducing this year. We're very excited about that. I think it's been a great collaborative effort with Aetna to work through, and really with all our vendors, because what we're trying to do is avoid that handoff and, no, you got the wrong place to call, let me go move you over there. It's really helping the person. They called up on, hey, my doctor told me I need an MRI, I'm not sure what to do. Well, there's a great opportunity to engage the person and start having that conversation, helping them use the various different tools that are available online to help them become a better consumer. So that's what we think is one of the opportunities we're going to focus on in terms of helping the employee be a better healthcare consumer. The second idea that we've implemented, which we're very excited about, have some great results, is a on-site health center. Mary touched on that a little bit in terms of one of the areas that employers are finding is a great opportunity to help and change the healthcare cost trend. But we think it's much more than just bending the cost trend. It is really a great resource and an opportunity to get the employee to start participating in their health and develop that relationship with the doctors. So we built a state-of-the-art health center in October 2011, so end of 2011. It's a 14,000 square foot facility. It's open to all employees, all their family members, retirees, as well as contractors that work on our campus. Our campus has got about 6,500 employees and probably about 10,000 when you include all the contractors that work on our campus. It's convenient, cost-effective facility, and to me the key is it fosters that relationship with the patient and the physician. I've got some great data that I'll share with you in a minute that kind of gives examples of that. But we just didn't kind of say, okay, if you're not feeling well, this is a great center to go use. We really try to build a comprehensive place for all the individual's healthcare needs. So from an individual, when they're thinking healthcare, it could be EAP if that's the issue that they've got. It could be physical therapy. It could be filling their pharmacy script. It could be seeing the doctor because they're not feeling well, or it could be it's time for my annual physical. It could be questions or issues they may have with the wellness program and a coaching program that they want to participate in. And what we try to do is put all those things in one place, so it's a single place for an individual they can go to, and it's a single place that they can access. So I've got some pictures, so rather than just going through and describing the center, I've got some pictures of our facility, and you see the various different centers. So we've got a vision center. That's been very, very positive from an employee standpoint. You can get your eyes examined, you can get your new glasses, all in the center over here. And you see on the lower corner there, we've got a full dental center in that place. We've got 3 dentists, 7 dental chairs that provide all dental services. Go trying to find a dentist on Friday afternoon and have an appointment and serviced over there. That's a great resource and an opportunity for somebody to stay on campus, not go out, not take the half day off, just be right there and then go right back to work again. Full service pharmacy, physical therapy. And the one that's in the center, I think, is really creative. So one of the things we try to, and we didn't invent it here, we borrowed it from other companies that have done a great job in implementing this, is a suite. So when you go see the doctor, it's not a clinical environment. So you see it, you've got the clinical table, but you've also got a nice big screen TV there, along with 2 nice chairs that you can sit there. And so when you go see the doctor and you're having your annual physical, you're sitting there face-to-face with the doctor. He's got his laptop with his medical EMT record, and he's displaying it on the big screen TV over there, and you're having a conversation about your health with your doctor. It's a great opportunity to engage the person The doctor's appointment times and the windows, since we're able to run the center, we can make those times so that when the person goes sees their doctor, they've got adequate time to go have that conversations, build that relationship, and we think that is a key tool in helping to drive and change healthcare delivery. So Take Care, who's a great partner that's been running the center, has, I think, just done a great job. So just some quick data points on it. 45% of our population, since it's opened in about 15 months, has used that center in some way, form, or shape. The pharmacy has just been a great success. We've got a significantly higher generic dispensing rate, which is the way you save money. And as a matter of fact, when you look at the doctors in the center itself, they're almost at 90% in terms of generic dispensing. That's as good as Kaiser and some of the best in class in terms of the generic dispensing rates. Over 2,000 annual physicals in 2012 were performed over. So that's a lot of our employees, their family members going in, building that relationship with the doctor. So, and then the last item there, just on the last, is we had projected it would take us about 3 years for us to get to break even and make that a financial attractive proposition. We're well ahead of that. We see the payback in significantly less time than that. And then the last thing I want to touch on before I turn it over is talk about results-based incentive programs. So we're going to be introducing this as part of we're going through annual enrollment right now, and our plan year starts in April. We're going to be introducing, we're not the first company out there that'll have a high deductible plan, so we're kind of late to the party. But I think one of the things that we're going to be introducing is a results-based incentive program. So as part of the health savings account, the company will contribute money into that account. We'll do a one-time contribution, so to help get people over the sticker shock of $3,000 money is what they got to pay before the plan starts kicking in. So we'll do a one-time contribution. But really the meaningful one is on an annual basis, we'll put $1,000 into your health savings account if you go see your doctor, you get results, and the metabolic syndrome is what we're measuring. So you measure on those 5 things, and if you're within a normal range in 3 out of those 5 things, we'll contribute $1,000 into your account. And we'll do that for you, and if your spouse does the same thing and they're on the plan, we'll do the same thing for them. So for us, it's a way of driving people to healthy behaviors. It's incenting people for having the good driver record, if you will. And it's a way for us to, we think, long-term help us manage our healthcare trend costs. So I think real quickly, those were the 3 things I wanted to talk about. I'm going to turn it over to Andy, and I think he's just got a fascinating story on his concierge model.
Thanks. No pressure with that, Carl. Thank you. Appreciate that.
Music, sorry.
Yeah, thanks. Thanks for having us here today. It is fascinating and really encouraging to hear all the things that other employers are doing, that we're all doing for our employees, kind of marching in the same direction. From Comcast, we're a media and technology company now, about 120,000 employees globally, mostly in the United States. And we have 2 primary businesses that we work out of. We have the cable division, which is the majority of our employees here in the United States. We have video, internet, and voice. We actually now also offer mobile technology through a Verizon partnership. So talk about getting vendors together. Verizon and Comcast have a relationship on the wireless side. So just do smart business, make smart business decisions is how we operate, and you'll see kind of how this works out. We also offer security, home security, and now we're into business, B2B kind of environment. And if anybody here is a subscriber of ours, we thank you. And if I could help to explain the value of your bill, I will be happy to take those questions after. We also have NBC Universal that we just recently acquired in the last couple of weeks. We acquired the remaining portion of a joint venture with General Electric. So that encompasses 30 cable networks, NBC and Telemundo, online programs, and Universal Pictures and theme parks. So maybe we will actually get to go to the Oscars at some point. I think I can take some of you and try to get you some roles in some movies if we can. So let's just talk about what's going on in kind of how we predict things, right? So we have a lot of predictive modeling tools and a lot of algorithms that work in healthcare, but really when it comes down to it, I think this slide says it all, life happens. And how people deal with those issues is going to be unique and different for everybody. If you had an issue, it'd be different for everybody in this room. And what your barriers and what your gaps are from knowledge and emotional barriers and the things that prevent you from doing the right things. And then on top of that, we have benefits people like myself, and I won't include anybody else in this in the room, but I've made it really hard for my consumer to figure out how to navigate the system. If I have a disability event, I probably have about 6 or 8 different vendors I have to call. Healthcare vendor, prescription drug vendor. Maybe I've got a comorbid condition, so I've got to call my EAP or Magellan. I've got to call my disability vendor. Yeah, I have to talk to my doctor. So there's just so much that we've integrated, and we've done it for the right reasons. But I think there's a sense that it ends up being a bad consumer experience is the way that we looked at it. And then, by the way, nobody pays attention to the information that you provide to them until they need it, or maybe it's too late. So we really wanted to look at and understand from where we sit and educate our businesses about the importance of having employees at work every day, having them be productive and have them be healthy. So the approach is similar to what I think you've heard other folks talk about today, and that really is make it easy, really. That's really the foundational component of what we want to get to. We want to provide support prior, during, and after care because people move through a lot of different programs. If you can catch them early, you might be able to prevent things. If you can help them while they're doing it, you can do it more efficiently. And if you can do it after the care and not kind of forget about them and understand that there's a tail to this, then you can, again, continue to impact both health and productivity. And we really focus on I think one of the unique parts of our program is we focus on the employee, but we focus on the family unit. We don't really look at the conditions that they may have and kind of bifurcate it that way. We say when people consume health care and when we looked at our information, people that go on disability, their families tend to consume more health care. So the sicker you are as a person, the more as a family unit you consume health care. So let's talk to that family unit. Let's figure out really what the drivers are within that family. So we do that by linking people, processes, and technology. We talked a lot about data feeds and information going back and forth and having good databases. But there are very good people that we work with at our partners. And sometimes it really does take a conversation between two people to figure it out and to figure out what's the best place because it always doesn't fit into those nice little matrices like this. So when we looked at one of our charts, this probably looks familiar to a lot of you, some kind of process flow. I don't really know. It's more like chutes and ladders. That's not really an easy process. So let's try to get to an easy process because we all are sick of looking at kind of those charts, or at least I am. So what we do for our employees is we provide all employees and their families with a health assistant, and it's through a company called Accolade. And these health assistants are provided to each family, and they are supported behind the scenes by nurses, doctors, clinicians, pharmacists, social workers, behavioralists, all kinds of different people, people that can handle claims. So what we really want to do is capture every interaction into the health system into one place so that I can undo the sense of all the bad decisions that I've made to separate our vendor partners. I can bring it back to one. And all the information and data can flow to one place, and somebody can give me a whole picture of my condition in one place. And I think the second point on here is around the trust level and building trust with people through the healthcare process. People, to be able to help influence a decision, they have to trust you. And from an employer's perspective, that can be difficult. From a vendor's perspective, no offense to our health carriers, but insurance companies don't have the best reputation with the consumer. They're trying to do the right thing, but people see them as a yes or no. Am I going to get covered or not? They get sometimes involved too late in the process. Again, things that we've created within the healthcare system. It's no offense to the work that they're doing. So if we can build a trusted relationship and take that call and get them the right support at the right time when they need it, they're going to call us back. And if they can call back, they can have a conversation, for an example, of, I need a new ID card. So they'll call this number and ask for a new ID card. The Accolade Health Assistant can help them with that question. If I asked my health partner sometimes to do that, they would fulfill the ID card request, and they would answer the phone in under 30 seconds, and they'd first call resolve it, and all their performance guarantees would be met. But the question is, which I'm sure you guys can ask yourself, or probably ahead of me, is if you're calling for an ID card, I'm guessing you're going to want to use the healthcare system. And if you want to use the healthcare system, what do you need in the healthcare system, and how can I help you? So it's a simple question in the interaction that we've tried to say, let's have everything come to one place and support these employees on what they need when they want it. And we have people calling just because we set up the environment for them to call. So this year, at the end of 2012, we'll have between 60 to 70% of our families, we consider everybody employee and their family, 60 to 70% of our employees will have called Accolade and used their services in a year. So that changes the dynamic because every interaction comes through here. So the question around disability and leave comes up as well. So I'm planning for a surgery that I'm going to start talking to Accolade about my healthcare condition, and they're going to talk to you about your disability benefits, and they're going to ask questions about that, even before they go on disability. People think about going out sometimes before they go out. So if you can, again, have better communication with them early on, get them to a better state before they go out, if they have to go out, then we can have them be able to get them back to work faster, get them recovered, get their health better. So again, that's the things that we focused on. And at Comcast, we're lucky and fortunate to have great benefits, but sometimes, the worst conversation I have with our employees is talking to somebody and explaining something to them, and they say, wow, I wish I would have known about that when I was going through it. Well, I want to be able to figure out, no matter how much I communicate to them, I got to tease that out of the information, and we have to do that as a company. So we make it very easy to find that information by having somebody who's an expert. And we really liken these folks, these health assistants, to, whether it be a financial planner or legal help, to be able to get to a place where, our vision is to be able to get to a place that if you're going to do anything healthcare related, you're just going to call Accolade, because why would you want to go through the healthcare process by yourself? Why not have an expert at your side? If you're going to go ahead and make a decision about your 401k plan or your financial, and you're going to buy a house, you're going to talk to an expert. You're going to talk to a financial planner. If you need legal advice, you're going to talk to an attorney. When you need healthcare advice, you talk to a neighbor, maybe a friend, a colleague. You don't really have that expert person that can manage both kind of the health experience and benefits and marry those two things together and really understand it. So that was our solution. This is how we made it easy. So we take that flow chart that we used to have and say to the employee, this is you and your doctor. We're not going to get in between that relationship. We're just going to help you make better decisions no matter what your condition is. So no disease management, no condition management. It's whatever you have. And the barriers that we've been able to uncover are just really not healthcare related. I think it was talked about yesterday. Folks don't get the right care sometimes, not because it's a health issue or don't get back to work in time. It's because of all the other issues that they struggle with. So I'll give an example. It's a little bit far-reaching, but it's an example. An employee that would not go for his surgery because he was living, he didn't have a family around him, and he had a number of pets, and he had nobody to take care of his pets. Who's going to know that is his issue on why he didn't get his service done? So Accolade helped him get to that service. So kind of the social aspect, the emotional issues, how do you get to those things? And that's what they're best at doing for us, trying to understand what are the other issues besides your health care that we have to tackle, and that's generally what it is. Financial is another very big issue. We talk about wellness, health and wellness. The financial component of this is just as important. We have a number of folks that go on disability that will end up in a spot where, and I'll show you some information at the end in our results, that just takes a lot of time for doctors to get information in, for them to get appointments. We talked about some of those struggles. They're not getting paid during some of these periods of time. They're getting kicked out of their apartments. They're not getting their prescription drugs filled because they don't have the money to be able to do that. Financial is very important to the health, to be able to sustain and to be able to get yourself better. So I'll talk a little bit about our multi-pronged communication strategy. So step one, for anything you're doing, whether you're an employee, a family member, call your Accolade Health Assistant. Step two, see step one. So that's as multi-pronged as we get. The sense is that if we can build that trust, and we build it with employees, with their health assistant, and they have a personal health assistant for them and their family, these health assistants will answer the questions and help them. And I think the other piece of our communication strategy, I do make it, a little bit fun of this, but I think the sense is that our supervisors, our frontline supervisors, trust that the system's going to work. They're very happy. Our frontline supervisors are so important to us, and you probably all may have experienced, I hope you don't have to experience in the room, where, especially in our call centers, you guys, people call in, customers call in, and then they don't get the help they want, and they say, can I speak to your supervisor? Supervisors are a very key part of our company, because not only do they have to supervise employees, but they're the next step of escalation. So if we can help take things off their desk and make it easy for them, because they like to deal with our employees, they want to help our employees, but they're not benefit experts. They don't know all the things that we have available to them. They're not counselors. They're not social workers. They're there to help make the business go. And if I can take that off their plate by saying to them, all you need to know is if you have something that with an employee, whether it's benefits related or not, but if it's healthcare, if it's family, if it's an issue, whatever it is, just call Accolade. Just call their health, tell them to call their health assistant. It's that easy. And our supervisors love that. So let's talk about the results. So we've got results on our healthcare side of the business and what we're seeing in better utilization and cost avoided savings. But I want to talk specifically around process gaps that were closed because of having this kind of relationship and this integration. And again, remember, kind of the whole point of what we want to do is capture every call that we can take and actually make it a call that we call a clinical engagement call, where we can take a call like an ID card issue or what's my benefit and turn it into what kind of provider do I want to go to? What are my treatment plan options? What are the things I can do to avoid work potentially? So the health assistant supported 42% of our employees on STD within 90 days prior to their disability event. So they're talking to these folks 90 days in advance, over half the folks, before they go out. So that's an important number. On average, they talk to them 3 times about their disability event before they go out on disability, and that's in addition to the 4 other times that they talk to these employees. And again, they're going to do they do things like in the concierge service model where they're actually calling doctor's offices to get appointments for them. A lot of employees say, well, my next doctor's appointment's not for 2 weeks. Well, that may not be the case. If you call up your doctor's office and try to move things along, they can do that work for them. So they're the experts at doing the outbound calls. So they really address not only, they don't bucket into disability or not, but when we look at truly the disability side, we do have an engagement. So while it's a small number of clients that call in for their disability, we do turn a lot of them into, the 40% of the calls get turned into that clinical discussion. And the results that you see here, so if you look in 2011, before we had put some of this program across the country, it was on average taking our employees kind of 13 days to go through the process, from filing the claim to getting the paperwork in, just because of the healthcare system, calling your doctor. Did they fax it in? Did they send it in? They didn't. What's my next doctor's office appointment? People being very confused with the process. We've trimmed 10 days off that process in a year by having people understand what needs to go on, talk to them earlier, get people to, if they're going to go out on disability, get them to call it in earlier. And where we feel the value of this is, our 90,000 employees, we have about 20,000 customer service folks and about 40,000 technicians. So 60,000 of our employees touch customers every day. So we need to make sure that they're at work, or we know where they are, or know they're going, or know when they're coming back. So if we can move people through the process, our business can have better expectations on when somebody's going to be back to work. And I come back to the employee experience because it's about the consumer. In 2010 and 2011, we would see about 150 employees that would be beyond 3 weeks without pay as they work through this process. So I said financials are a really big part of that. We have that down into the 10s and 20s at this point, where there's people that are not without pay for 3. That's important. So if you get people paid and you can help them through the process, I'll tell you what, they will listen to you when you give them advice. That is, and it just is a better experience, and it's not the advantageous experience that sometimes we've built and sometimes that we've seen with our employees. So we're happy with the results from this specific slice of where we're going. With that, I think the music's going to start to play so we can take some Q&A. So thank you very much for having us.
So if nothing else, we proved that this panel can finish on time. So Ed, you must be very proud. So before I open it up to questions, we got about 5 minutes for questions. I just thought I would poll our employer members and maybe Mary as well to try to get a sense for how the industry is doing over the past, since we presented 3 years ago, and whether or not there's a sense that the vendor community in particular, which I'm a member, Ed is a member, Rich is a member, whether or not we are playing a little bit nicer in the sandbox and whether or not we are being productive in doing so. And I'll ask any of the employers to comment on that. Andy, I'll start with you, since if you've got anything to say about it. Are we doing better or are we doing worse?
I think there's a sense both. That's a good answer, right? No, I think that
was the wrong answer.
It is. I think the environment that employers in the room have pushed there. I think, and it's the work of the folks like all of you that have asked the vendors to be able to do that. I think, again, it's just a different environment, and I think that, you know, the receptivity from the vendor community is there, and I do like to see, especially in our case, we see vendors that normally compete every day, really sharing information, thinking about the consumer, and not really worried about who does it belong to. Just let's get this right, and that's a better experience.
I'd say certainly the relationship and working together, partnering, has improved a lot over the last 5-10 years. But I'd also say the bar also keeps getting raised, right? I mean, so I think the expectation, if you were competing 5 years ago versus today, you'd say, hey, I'm doing a great job, but also the bar is moving up. And so how do you engage the consumer? The world is getting more complex, so how do you figure out what are the next steps that you got to do to engage the consumer? It's unfortunate. The average employee is not engaged in their health. They really don't understand. Their health is getting worse versus improving. So how do you truly move beyond the chimneys and move to beyond just passing data and having warm transfers? How do you put programs together that really helps the employees? So I think that's the challenge for us over the next 5 years. We've done a great job. We've moved the needle. Where do we got to go next?
So that you all have time to ask questions, I'll just say that I agree that it's moved along. My perspective is it often depends what kind of data you're asking them to share.
So, do we have any questions from the floor?
Hi, my name's Art Taft. I'm a consultant here today as a consultant to the National Association of Chronic Disease Directors. For those that aren't familiar with the organization, it has 3,500 primarily state public health officials. My question is actually in response to Irene's comment. I'm paraphrasing a little bit, but you're finding that some of your employees are reaching out and finding programs that are appropriate for them and are using those instead of potentially the programs that Key is offering for them. My question to the employers in the group is, do you see that as a trend? Do you see yourselves opening up your benefits to potentially reimburse for those programs if there were fees associated with them, if they were appropriate, rather than using the model that's existed for several decades, where you as an employer pick a winner and then try to make that the standard program that's available? Thank you very much.
So I'll take the first shot at answering that. I would say that it's a potential. Most of the opportunities our employees are reaching out to are at their own cost or at no cost. There's a lot of cost pressure on employers right now, and so I think there could be some concerns there, particularly once the health plan reimburses, we get into another arena. So, you know, might that be something they can use their health savings account for? Possibly.
Bob Morrell, HHI Healthcare Solutions. I'm a little surprised that we're using the word vendor, because everything that I have been reading and most of the conferences I have been attending, the people like the D. Eddingtons of this world and John Riedel and what have you, certainly have been preaching to move away from vendors and move to partners, where the most important end result is all about outcomes rather than participation. And I would love to hear your comments about how important is it for your partner, who used to be a vendor, hopefully, now become the deliverer of the outcomes that you're really looking for.
Mary? Sure.
So, I mean, I agree with you. I think the right way and the place that I think everybody should be heading is in that developing that partnership. And I give you a perfect example. So when we bring on board a new partner, it's getting them to understand what's the BP culture and how do you operate in the BP environment so it makes sense and you can relate with the employees. Our culture with the 80% male that's in the oil rig work is very different than a key bank, for example, where it's majority female population. So understanding how that employer base is and how do you make that right partnership together, and that's the give and take, I think, that is absolutely so critical. And it's both sides. So employers have to have that different perspective. It's not just the vendor. I'm going to hold them accountable short term and this quarter's metrics to here's the strategic relationship, as well as from a company, the vendor side, they got to keep, how do I make sure that I'm servicing that company where I'm part of that team, not just another vendor that's providing a service, right? So it's you got to think differently on both sides.
I'm going to agree with all that in terms of our ultimate goal is to view these relationships as partnerships, but I think it's a earned status. It's not something that just comes right out of the bat. And I also want to use this opportunity to plug the IBI DVD, which I believe is available out in the lobby, about turning vendors. I think it's.
We've got T-shirts too.
It's about turning vendors into partners and what both sides need to do. And Chris McSwain, our board chairman, and Tom Perry are featured prominently in the DVD. And ultimately, that's where we want to go. But it is an evolutionary process, starting with a business contract and then moving into a true strategic partnership.
Yeah, and I would echo that. I think it is evolutionary, and I'll take responsibility, I think, for starting to use the term vendor. But, you know, that comes after years of being told, well, you're not really a partner, you're a supplier. And no, you're not a supplier, you're a partner. No, you're really a vendor. And so eventually I think it is just a term that we use, and it is about whether or not your suppliers or your partners earn that trust. Yes.
I think we're at time, but
one
can
more.
we do one more? Okay, great.
I can't just wrap it up that fast. We were doing good on time.
My name's Tanya with Recess, and I'm going to be a little provocative, if that's okay.
Ed, you take this.
Get your defenses up. So we're hearing a lot about integration and partnerships, and the representative from Aetna talked about the sort of 6 phases of integration. We work with employers that have between 200 and 10,000 employees, but the average is really around 500. And that's most employers in America. That represents most employees in America. So when you have organizations up here that have multiple billion-dollar budgets and thousands of employees, you go to stage 6 of integration. But I'm here to tell you that the integration for these small employers is still at stage 1. And it's not a partnership. It's very much the opposite, where you come to the table and say, we want warm transfer, we want integration, and it's like, well, tough. So someone from Virginia talked about how do we create these partnerships and mentorships, but the truth is what's working for jumbo employers is not working for small employers, and the partners aren't coming to the table. They're the big guys. So what are your thoughts on how to make this, how to bring that integration to small employers, give them access to their data, facilitate the integration between their 13 to 18 different wellness vendors, and really bring them the same kind of best practices that you guys have been looking into for the past 10 years?
Yeah, Rich, what are your thoughts on that? This is one of my partners.
That was actually a great question, and thank you for your honesty. It's a very, okay, there we go. It's a real problem, right? And there is no, try not to make this echo here. Can you hear me? No easy solutions. I'm going to offer up one that I've seen begin to take traction, but I'm not going to oversimplify it. That's a hard issue, because in response to the last question about partnership, it's not just senior or strategic. It gets down to the care team, those who interact with your members, and you need a certain degree of scale to have employer specificity, a designated team, a dedicated team, that kind of thing, right? Specialized handoffs with other partner organizations, not vendors. And so one solution that I've seen that addresses that space in the employer market is bringing together employers that have common needs. And they may already be self-organized through whatever groups they're in or how their businesses relate to one another, but bringing them together into a common care team where they've agreed to not do things entirely differently from one another, but to have a shared experience. And by doing so, we can bring together, and we have a few examples of this, maybe 10, 20 small plan sponsors, and have a fairly tailored experience that meets the needs of that community of like minds.
In like a trade association, or because you start getting into MIWAs and problems like that, it's purely for the interest of
right.
obtaining a good.
Let me give you two examples, but this is by no means limited. There probably are many more that this might spark in the audience in terms of ideas. One example is a dedicated unit that does a lot of this customization and specificity and tailoring, the things you're asking for, that brings together separate companies that have a common private equity ownership. And so through that ownership, we bring them together. And other examples relate to what some of the consulting firms are doing, bringing together smaller employers into a care model where the partner health plan and the partner consulting firm can have a fairly customized experience. There are probably other ways of organizing it as well, but doing one-offs of 500 employees, that's a challenge.
And I would just add that the health assistant, health coach model, I think could be the solution for the smaller employer, and we spend a lot of time on both the concierge and the health assistant model. And I think, I'm sorry. I think the health assistant, health coaching model could be the solution, so the smaller employer could contract with a firm like that who would then help organize the other vendors in a more meaningful way than perhaps you can do as an individual. And I think that from some of the experience, but it's too early for us to report out on yet, is that there are savings that you recognize from the model that Andy spoke about. And so it would make it, I think, something that is also affordable for the smaller company.
Okay, we went from being a good panel to a bad panel. I apologize for that. Thanks for your attention, and I know there were some additional questions, and if you want to try to find members of the panel later on, I'd be happy to answer them. Thanks very much. Have a great conference, folks.